My dear students, OET aspirants, good day. Have a good day. Okay, so today is our 48th live session. We are here with അപ്പോൾ നമുക്ക് ഇന്ന് നല്ല ഗുഡ് ഈവനിങ് ആണ്. അപ്പോൾ ഞാൻ ടോട്ടലി ഒരു ഗുഡ് ഡേ എന്ന് പറഞ്ഞതേ ഉള്ളൂ കേട്ടോ. ഓക്കെ, അപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നു, സുഖമായിട്ടിരിക്കുന്നു, ഹെൽത്തി ആയിട്ടിരിക്കുന്നു, സേഫ് ആൻഡ് ഫിറ്റ് ആയിട്ടിരിക്കുന്നു എന്ന് കരുതുന്നു. ഓക്കെ, സോ ദിസ് ഇസ് അവർ 48th ലൈവ് സെഷൻ. അപ്പം രണ്ട് ക്ലാസ്സോടും കൂടെ നമ്മൾ എന്താണ് ഗോൾഡൻ ജൂബിലിയിലേക്കോട്ടൊക്കെ പോവാണ്. About 48 exam topics we have discussed so far, 48 questions, exam related questions. So I want all of you to go through all those previous topics so that you can have clear appreciation over the questions that to be asked for your exam. Okay, even you can prepare for an A band if you work with your heart and soul. Fine. അപ്പോൾ എല്ലാവരും നന്നായിട്ടിരിക്കുന്നു, സേഫ് ആയിട്ടിരിക്കുന്നു ഒക്കെ ഒന്നുകൂടെ ധരിച്ചുകൊണ്ട് we are here back to our questions. Okay, so soon we are going to launch the question. There are no other concerns or doubts. This question was sent to me by Rincy. Okay, Rincy has sent me this question. So I want all of you to have a look through this question. We will discuss it fast and we can go for a question presentation. Fine. Here is the question. Right on the screen. Okay. Yes. Community health center is the setting. Okay, community health center is the setting. You see a 40-year-old patient who has just had a large carbuncle, that is, a pus-filled skin infection on neck, surgically drained under sedation. Okay, you have just packed and dressed the wound and now advising on next steps. Confirm completion of wound care, find out how patient is feeling. This is a community health center. The patient was here with a carbuncle. That means a pus-filled skin infection near to that neck. It was drained surgically under sedation. Got drained. The wound is completely drained in sedation. We have just packed and dressed the wound. Our duty is like packing, dressing of the wound is over and advising on next steps. Now we need to advise them regarding further steps. Okay, that's completion of wound care. Find out how experience. So this is a non-case, clear non-case. We cannot go for a fresh introduction like good morning, good evening, or good afternoon because it is said like we have just finished the wound care. We need to start from completion of wound care. Okay, not like usual. Good morning, how are you doing? What is your complaints? Never ask all those things. If you ask like there would be that doesn't make any sense and you may lose your score. Okay, that is not proper channel to begin the topic. We need to start as if we have completed the wound care, find out how the patient is feeling. So just start with the completion of wound care, find out how they are doing, the patient is doing. Okay, next is like explain next steps like arranging pain relief. Okay, we'll be arranging pain relief for them. Keep the packing on. We have to ask them to keep the packing on. Repacking, top dressing on alternative days. So this dressing should be changed on every alternative days. Next, outline need to keep packing on. Why it is important to keep the packing on? Or until when? Until next follow-up appointment in 3 days. So the packing which is on the dressing should be kept for another 3 days till their next follow-up. So the next follow-up is scheduled after 3 days. Till then, they need to keep the present packing on. Okay, that's it. Now, stress importance of hand hygiene during dressing. So we need to make them know it is very important to keep the hand hygiene whenever they do go for dressing. Fine. It is to prevent the risk of infection. Okay, prevention of infection. Warn against interference with wound. Frequent interference, unnecessary interference should be avoided. Why? Risk of damage to the packing, secondary infection can happen, prevention of healing. These are the complications of frequent interference with the wound dressing. Okay, so we need to ask them to avoid that. Fine. Give details of follow-up appointment. What will be done during follow-up appointment by their next visits after 3 days? What will be done during that time, like bandage removal, wound examination, self-care advice, all will be given during. Fine. Find out any other questions. We need to ask them whether they have got any other queries or concerns or questions. Fine. Reassure patient about healing of wound. So they may be doubtful about the healing of wound. We need to ask them about the healing of wound, like low infection risk, 7-day course of antibiotics. Okay, so the risk for secondary infections or other complications are very less. We can assure them because there is a course of antibiotics for 7 days. It's prophylaxis. That means again, this preventing against preventing the infection. Okay, it is against the infection, this prophylaxis. Okay, and begin immediately. They will soon start the medications, prophylactic course of antibiotics, so there is no risk of the risk for infection, and the complications are very, very less. We need to reassure them. Fine. Explain when to see the doctor. At the same time, we need to ask them when to come for doctor's consultation. Okay. Increased pain, feeling unwell, fever, leakage of pus blood, etc. Okay. So, what are the indications to come to doctor if the pain increases, if there is any fever or the patient is feeling down or unwell, if they notice some leakage of pus or blood? In case all these are the indications for them to have an immediate visit to the doctor. Okay. We can ask them to come to a consultation, come for a consultation. Fine. Find out about patient's transport home arrangements. At the same time, after finishing all these investigations, examinations, inquiries, we need to ask them how they are going to get back home, how they are planning to go back home. Stress importance of not driving. They may be urging for a self-drive, but we have to ask them to prevent. We have to prevent that. We have to strictly warn against that, because there is restriction of neck movement. After effects of sedation are still there, not covered by insurance. That means in case any emergency or casualty happens, if the patient goes for a cell drive and they meet with some sort of accidents, that won't be covered under insurance. Okay, they are out of insurance package because they're still under sedation observation. Now they are not fit enough to go for a drive. Okay, that is what. Advise need for alternative transport arrangements. Finally, we have explain them. It is very important to go for an alternative. They have to make some arrangements for transporting, getting back home. It is how we need to finish. General sort of instructions and other information, we can finish the topic. I hope the question is clear, my dear students. Yes, any queries or concerns, you could pin it in your comment box. In case if you have got any suggestions, queries or concerns, please. Question is quite easy. It looks bulky. So in this questions like this, you need to organize the time. It is very important to organize time. Okay, organization skills are most needed in in questions like this, bulky questions, heavy questions with multitude of tasks and indications points. So many are there. Okay, I think everything is clear so far. Yes. So shall we go for question discussion? All are ready? Shall we begin? Okay. Yes. Okay. So some of our students have given permission uh, for continuing the conversation. So we'll start that. Okay. So many to okay. Beulah has reported her comment like, "Good evening. I'm on duty, sir, unable to attend live." No problem, Beulah. It will be displayed there later on your YouTube and Facebook channels. Both will be displaying this online sessions. You can take notes from that. Okay. In case of any queries later, you can just put your comments in the suggestion box. We will definitely address that. Okay. God bless you all. Yes, thank you. Thank you for supporting me through your comments. Thank you, students. Okay, let's start. So I told you we need to start from completion of wound care. Never go for any usual good morning, good afternoon and all. This is not the way. We need to start from the completion of wound care. Okay, so how we'll be starting, how we can start our role play. Yes, Mr. Martin, suppose we can take the name, universal name of mine is like Martin. Let us go with that. I'm so comfortable with that name. Okay, yes, Mr. Martin, dressing is over. Now you may please sit up. Okay. Now you may please sit upright. Okay. In a straight position, you may sit upright in a straight position. Okay. Now you may feel comfortable. Please feel comfortable. Okay. So this is how you can start the topic. Yes, Mr. Martin, it's over. The dressing is done. You may please feel comfortable. Are you okay? Any discomforts? How are you feeling now? This is the usual introduction that you can give for the statement. Yes, Mr. Martin, it's over. The dressing is done. Yes, now you may now you may please feel comfortable, relax. Everything is done. You're okay. How are you feeling now? Any discomforts? Patient blessing, like, no, nurse, I'm feeling good. So, what will you be? What will be there further, nurse? They will be asking you. There is nothing to be overly concerned about. There is nothing to be overly concerned about. The insist this carbuncle has been removed. Okay, so the carbuncle is removed. Nothing to be overly concerned about. Carbuncle is removed. Everything has been surgically drained out. Now it's clean, the packaging is on, the wound packing and dressing is on. Wound packing and dressing is okay. Now we'll go for further prescriptions. There will be pain medications, antibiotic medications. We'll go for prescriptions. Okay. And I strongly recommend you to change this packing in every alternative days. And I strongly recommend you to go for wound packing in every alternative days. Okay. That should be done without any fail. Are you getting me? Okay. Now, for time being, you need to keep the packing on for 3 days. Your next follow-up is scheduled after 3 days. Okay. Now, for time being, you need to keep the present packing on for 3 days. As your follow-up is scheduled after 3 days. Okay. As your follow-up is scheduled after 3 days. Okay. Now, for present, for time being, you need to keep this dressing on for 3 days as your follow-up, next follow-up is scheduled on that. As your next follow-up is scheduled on that. All right. So the patient will be saying like, okay, nurse, yes, I will definitely go for that. And what about dressing? Can I do that? Yes, you can do dressing by self, but make sure that you're maintaining hand hygiene. Okay. Yes, you can do dressing by self, but avoid frequent interference. Before doing dressing, it is a must to ensure hand hygiene. It's a must to ensure hand hygiene because the risk of infection is more if you don't follow strict aseptic practices. If you don't follow strict aseptic practices, fine. So they'll be asking, why nurse? Why you have said like frequent interference is not permitted? Then how will I be able to know that? See, if you go for frequent interaction with the wound, it may damage the dressing. See, if you go for frequent interference with wound, if you frequently interact with wound, if you frequently disturb the wound, it may result in damage. It may result in damage. It may damage. It may result in wound pack damage, or it may result in okay. It may damage, or it may damage the wound packing. Okay, it may damage the wound packing. Okay, as such, the risk for secondary infection, ascending infections are more. As such, the risk for secondary infections. As such, the risk for secondary infections or other ascending infections are more. Yes, and it can delay the healing. It may delay the healing. It may delay the deal. It may delay the healing and go for other complications. Okay, it may delay the healing and can go for other complications. So it is better to avoid frequent interference. You can have dressing removal. You can do redressing. You can do redressing in every alternative days. Got it, Martin? Hmm. So they will be saying like, yes, nurse, I'm getting you. Tell me, nurse, what will be done during this follow-up appointment? Tell me, nurse, what will be done during this follow-up appointment? They'll be asking. Yes, during next follow-up, as I mentioned, your next follow-up is after 3 days. Do come for that. At that day, the bandage will be removed. During your next follow-up, the bandage will be removed. Okay, the bandage will be removed. Proper and detailed wound examination and assessment will be done. Proper, detailed wound examination, thorough wound examination will be done at that time. Wound examination will be done at that time. Thorough wound examination will be done at that time. Okay, and the doctor will give further advice on self-care and other um, measures. Okay, and then the doctor will advise you regarding further treatment and self-care measures. Then the doctor will inform you regarding further treatment and self-care measures. You can follow that. Understand? You can follow that. Understand? So they will be saying like, yes, Nash. I hope you're clear so far. Any other questions for me? Please tell me. Any other questions for me? Or if you have got any concerns, feel free to ask. Okay, they will be asking you. Fine. So they will be asking like, nurse, I'm really worried about this wound healing, nurse. I don't know about this healing and how long does it take? I'm afraid whether it may go for some delay or something. The patient will be actually asking you. So what we can say like, you don't have to worry. No worries. Come on, Mr. Martin. No worries. Come on, Martin. No worries. There is nothing to be anxious about. Okay, wound healing is confirmed in this case. Okay, if you adhere to the instruction, there won't be any delay in wound healing, or there won't be. Come on, Don't be anxious, Mr. Martin. Okay, come on. Don't be anxious, Martin. Okay, there won't be any delay in wound healing if you adhere to the instructions as advised. If you adhere to the instructions as advised, there won't be any delay in wound healing if you adhere to the instructions as advised. If you adhere to the instructions as advised. Okay. Soon we will be starting a 7-day prophylactic antibiotic course. Soon we will be starting a 7-day prophylactic antibiotic course. Okay, it is to prevent infection. It is to prevent the risk of infection. It is to prevent the risk or chance of infection. Okay, the risk of infection. Okay, you have to make sure that you complete the course. Okay, you have to make sure that you complete the course. You have to make sure that you complete the course. Okay, skip the doses at all. Never skip the doses at all. Never skip the doses at all. And see, the wound packaging is on, sterile dressing has been done. So the risk for infection is very, very less. So the risk for infection is very, very less. Stay confident. Stay confident. Stay confident. Stay confident. Are you getting me? Yes, my dear students. But you can come for a consultation. 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 But you can come for a but you can come for a consultation if you see something unusual. If you see something unusual like increased pain, increased temperature, I mean fever, if you feel some discomforts, okay, if you feel some unpleasant sensation like discomforts or some oozing or leaking of pus of blood around the dressing, okay, in case if you notice any of the symptoms, never delay, get back to our clinic immediately. Get back to our clinic immediately. Get back to our, but you can come for a consultation if you notice something unusual or unpleasant like increased temperature, I mean fever, increased pain, okay, oozing or leakage of pus or blood, okay. If you have any unexplained discomforts, if you notice any of the symptoms, okay, get back to us immediately. Okay, that could be some warning signs of infection. Um, that could be some warning infection. Okay, so get back to us immediately. All right, all right, all right. Okay, so the patient will be saying like definitely. I hope you're clear so far. Any other doubts? I'll be saying like, no, not some. Okay, I won't get it. Well, now tell me about your transport home arrangements. How do you plan to get back to home? How do you get back to home? Who will be there to assist you? Okay, who will be there to take you back? Okay, how do you plan to get back to home? Or how? Um, what is your transport arrangements? How do you get back to home? Okay, who will be there to assist you? Or who will be there to take you back home? Who will be there to accompany you? We should be saying like, no, I'll go for a drive by self and go. Absolutely no, Mr. Martin, we cannot allow that. Absolutely no. Absolutely no. We cannot allow that. You cannot go for a drive by self. So you cannot go for a drive by self. You cannot go for a self drive so far because now you are still under sedation. Okay, since the carbuncle has been removal has been done, the surgical draining has been done under sedation. You are still under the effects of that anesthesia sedation. Still, the effects of sedation are there. Moreover, your neck movements are restricted. Moreover, your neck movements are restricted. So the driving by self is strictly restricted. In case if you go for a self drive and meet with some sort of emergency or casualty, that won't be covered under insurance. Okay, that won't be covered under insurance. Okay, there won't be any insurance package or coverage for that. You cannot avail any insurance coverage of that. Are you getting me? So it is very necessary to arrange some native transport arrangements. So it is very necessary to arrange some alternative transport measures. Please tell me, what are you going to do? They'll be saying like, yes, I'll arrange my friends to be here. Yes, that's great. Please do the needful. Yes, that's great. Please do the needful. Now it is a must. Yes, that's great. Needful, that's a must. Now that is a must. They will be saying like, sure, nurse, I will do that, nurse. Thank you, nurse. Will be saying. I hope I have assuaged all your concerns. I hope I have assuaged all your concerns. Any other queries or concerns for me? Any other queries or concerns for me? We say like honors. Okay. If you have some queries or concerns, okay, feel free to ask if you are in need. Okay, feel free to ask if you have got any questions. Feel free to ask if you have any questions. We are here to help. We are here to help. So they'll be saying like, thank you, thank you. Now I will leave you to have rest. Now I will leave you to have rest. Now I will leave you to have rest. Later we will plan for your discharge. Later we will plan for your discharge. Okay, I will leave you to have rest. Later we will plan for your discharge. You can go home today itself. You can go home today itself. Okay, relax, feel comfortable. Relax, feel comfortable. Relax, feel comfortable. By that, we are finishing. That's all. We have come to the conclusion. The patient still taking rest. Okay, that's it. Relax, feel comfortable. Ending up the conversation. I hope the dialogues are clear so far, my dear students. Any doubts, any queries or concerns? I hope it is done. So read the question, plan your own dialogues. Okay, you can just listen to this my dialogues, and you can never go for by hearting or mugging up the topics by heart. Okay, never mug up or never by heart the thing, because that sounds monotonous. Instead, you just listen, organize by yourself. Just develop a version of yours so that you can present it with a natural sense. Okay, your intonation, your sound modulation, all will come naturally if you go for a self-presentation. Do like that, practice like that. Okay, so we'll be here again on this virtual platform with our 14th live session by next Friday. Till then, take care, all of you. Bye. God bless you.